Alright, so in a previous video we talked about some laying down or supported positions to try and alleviate back pain. Now the next step would be to try and do some of these similar motions in a standing position. One, because it's more convenient, and the other piece is that we function standing a lot more so than we do laying down. So ideally getting to this load-bearing standing upright position is ideal. So once we feel that we've tried some stuff laying down and that's been effective, or maybe that hasn't been effective and we're looking for something else, this is kind of the next step in the process to look for something to alleviate this pain. So the most important thing is that we find some movements early on that are effective at decreasing our symptoms, especially if we find ourselves in positions throughout the day that agitate them. A lot of us have to go to work, and we have to drive in a car to get there, we have to sit at a desk, and to some extent we can't get away from those types of things. So what we're looking for is we're trying to balance the equation to some extent. If we're in positions that irritate our pain, we got to try and mix in some movements that are easy to do to try and offset the bad positions that we have to be in with our daily activities. So same idea, we're looking for that movement or directional preference. So in standing, I kind of look at a couple of these positions, and same thing, you want to pick the one that feels best and do that a lot. So initially I'm going to look at someone and I'm going to say, all right, I want you to take your hands on your hips, and I want you to lean back, looking up towards the ceiling. And my question to them is going to be, as you do that, does it feel better? Does it feel worse? Does it stay the same as far as the pain that you have? And if they say, oh, it's getting worse, I'm going to say, okay, stop doing that. But if they say, it's a little uncomfortable, but the more I do it, it actually feels a little better. That's the response I'm looking for. Or at the very least, it stays the same. Most of the positions that we're in throughout the day put us in this flex, not so good posture. So ideally, I'm happy if extension is the thing that works, but it doesn't always. The other piece is bending forward. So I would have somebody bend their knees a little bit, and I would say with your hands on your thighs, kind of let yourself reach down towards the floor, and you can even keep yourself supported on your knees for a little bit of support from the back. And then same question, as you do that, does your pain feel better? Does it feel worse? Does it stay the same? If it feels better or it stays the same, that's the response I'm looking for, ideally even better. But if they're saying, this is starting to make my back sore, or I'm starting to feel numbness in my foot, those are not good. So that would be a position that I would actually avoid. Okay? So that's just the straight plane bending forward or bending back. Now, we don't always find those to be the most effective, especially if you have pain that's more on one side. So we look at this shift correction series as another option. So as I come over to a wall, a lot of times what I'll see is if I have back pain, let's say it's more on my right side, usually my body's reaction is to shift away from that pain. So subconsciously my body is going to want to move away from that pain because to some extent it'll make it feel better. Now initially this is a good idea, right? Because we want to do anything that makes the pain feel better. But the problem is that the more that we get used to being in that posture and I've shifted away from it, the more that there's tension on this side of my back. I kind of describe it as like if I'm carrying a weight in this hand or carrying something like this all day. Initially this may feel good to shift away from that pain, but the more that I shift my shoulders this way, it actually puts more tension on this area. And the goal would actually be for me to get my shoulders back over top of my pelvis. So the other option is going to be to have your hand against the wall. And starting off, if I have pain on my right side, meaning that typically my shoulders will glide to the left, my goal is going to be to try and get my hips back underneath me. So really what you want to look at is you want to try both ways, you want to see which one feels better. So if I take my hand against the wall, and I lean against it, I take my other hand on the side of my hip, and I keep this elbow straight, and it's not a very big motion, it's just a very subtle dip of the pelvis inward. And it's the same question. As I do that repeatedly, do my symptoms get better, get worse, stay the same? As long as they're staying the same or getting better, that's what I'm looking for. Okay? The shift correction has been shown to work very well for people with discogenic back pain, especially people that say that it feels better to be standing and up and moving around. Their pain is worse with sitting, coughing, sneezing, driving in the car. Okay? So I would say, okay, let's compare that to the opposite side. Hand against the wall, same thing. Does my pain feel better or worse? The same. And specifically, if I have any pain into my leg, that is much more important than even local back pain. So when I get the pain in my leg, that means that there's pressure on a nerve, and I want to reduce that pressure. So every time I'm talking with a patient, I want to make sure that I'm focused on what's happening in your leg. Is your leg getting worse, better, or the same as you do that repeated movement? Ideally, we're looking for a movement that makes that pain better. And as we talked about in the previous video, you can do any one of these movements 10 to 15 times every hour to try and offset the fact that with your daily activities, you're probably loading your back in a way that's not great. So we have the bending forward, hands on the knees. We have the leaning back. We have the side glide series. We also have rotation. So sometimes I'll have people hold on to something, whether it's a towel, pillowcase, or even just a stick, or even just hands together. And it's the same question. As I repeatedly rotate to the right, do I feel better or worse the same as I do that? Compared to if I repeatedly rotate to the left, do I feel better or worse the same as I do that? So with all this stuff like we're talking about, you want to pick the movement that feels the best as a good starting point. Ideally, you'd be able to move in all of these directions without pain. But initially, when you have that pain, you're looking to try and do anything to alleviate it, and this is a good way to do that. So good luck.